Hi there. Welcome to the Health Analytic Insights podcast. This podcast is all about creating a community of like-minded individuals who are passionate about the field of health informatics. I hope to share information and advice in topics such as health analytics, digital health, biomedical engineering, and data visualization in healthcare. And in exchange, I would love to hear from you, dear listener, about your experience and interest in this field. You can drop me a line at healthanalyticinsights@gmail.com, and this email, along with any references discussed during this podcast, will be listed in the show notes below. If this resonates with you, don't forget to follow and subscribe to this podcast, as I'll be releasing new episodes bi-weekly. Before we jump into the episode, I want to let you know that I've written a step-by-step guide to help you through the process of securing your first role in health informatics by providing you with concrete examples of what roles to search for, common skills requested by employers, example interview questions, and much more. If this is of interest to you, you can check out the show notes of the episode where I have a link to the ebook below. Now, let's get back into the episode. So I often talk on the podcast about some of the data challenges that health informatics professionals might face on a day-to-day basis when it comes to cleaning and wrangling healthcare data within their job. And you might have seen it quoted in several different articles that when it comes to the data analyst's job, you might spend 70 to 80% of your time just on data cleaning, 20 to 30% of your time on the fun analytical work. I can either confirm or deny this, but I think most of us can agree that when it comes to data cleaning, this is a portion that we all have to muddle through. So in this podcast episode, I wanted to do a deep dive into some data problems you might or might not have encountered. And I'd love to hear from you at the end of this episode. Can you relate? What did I miss? Let's get into it. Veracity, variety, and volume. These are terms you might have heard attributed to big data challenges within different industries, and healthcare is no stranger to these concepts. So if we start with veracity, when it comes to healthcare data, we want to ensure that the data we're using originates from a trustworthy source and is entered in with a high degree of accuracy. Healthcare information can come from multiple sources, such as a clinician entering in the data of the medical encounter of a patient into the electronic health record. It can come from blood works, from the labs, survey data, from public health professionals. And as a result, all of these different types of healthcare data, there can exist issues with the accuracy of the data entry process. For instance, a clinician might find some of the questions subjective, and a patient might not want to answer a sensitive medical question, resulting in a large amount of missing data. So in a research paper titled Challenges to Electronic Clinical Quality Measurement Using Third-Party Platforms in Primary Care Practices, The Healthy Hearts in the Heartland Experience, authored by Dr. Ahmed and others, which I'll link to in the show notes, these researchers highlighted some of the data challenges they identified within electronic health record systems when it came to issues such as correctly categorizing healthcare data according to different standards within the healthcare system. And this leads us to another issue with healthcare data, which relates to missing data. As I said before, missing data from surveys. This is quite common in healthcare data. And during my master's, I took data from a healthcare survey administered by the CDC, and there was a lot of missing data that I had to deal with prior to applying machine learning algorithms. And when it comes to asking people questions about healthcare data, this can feel intrusive to the respondent. Questions such as how many glasses of alcohol do you have a week can cause people to not answer, leading to large amounts of missing data. And I think many different researchers can relate to tools and techniques that are necessary to deal with missing data. But I'll just say there are generally three types of missing data: missing completely at random, missing at random, and missing not at random. And having an understanding of why your data is missing is key for carrying out complex analysis. So when it comes to dealing with missing data to improve the accuracy of the data set, you could either use a statistical package like MICE, which stands for Multivariate Imputation by Chained Equations, a software tool such as R. I'm sure there's a similar library in Python that you could use, or you could take a look at how the question or survey is being designed to better improve your chances of data being entered in. From the lens of the health informatic professional, this could look like having conversations with clinicians and understanding what are the limitations for them when it comes to entering in the data. And this could stem from a variety of reasons, from a lack of time or lack of understanding on how entering the data will be a benefit for them. And for me, this is where the power of data visualization can really come in handy. When I worked at a nonprofit, primarily building dashboards in Power BI, what really made a difference to the audience was showing the missingness of the data, where people expected to see metrics displayed. And this is where you could start to have conversations with individuals to let them know that the data was not there because it wasn't being entered in correctly. And when they could see the gaps in data entry, this was powerful for them to start to enter in the data correctly or help train their staff to start entering in the data correctly. So oftentimes it can be really difficult to conceptualize the importance of entering in data correctly if you can't see the direct downstream effects, and visualizations in the form of graphs or charts can really be helpful to jumpstart that conversation. And as health information professionals, we want to create a feedback loop where the clinician is involved with the data capture and gets benefits from outputting actionable information that can help to improve programs, clinical practice, and of course, patient outcomes. So finally, when it comes to the veracity of the data, a data governance framework can be helpful for the entire organization, but especially so for the individual who is entering in the data. A data governance framework will have extensive documentation on standards and policies developed by the organization. For instance, a standard definition on how hospital length of stay should be calculated. And there should be certain logic rules in place to help guide people to enter in the data accurately. For instance, the age of the patient should not be less than 0. Data governance is especially important when dealing with healthcare data because most likely your organization reports to a higher government body that would require certain veracity of the data, and this might be tied to funding. So it's really key to get the data as of high quality as it can be. So moving on to the second term, variety. And one of the great things about working in the health informatics field is the variety of healthcare data that you might have an opportunity to interact with. And if you think about the future, it would be great to be able to integrate all these different types of healthcare gadgets and tech that we have out there, from healthcare data from the Fitbits to health apps to EHR records, being able to just integrate all these different sources of data to really tell the story of the patient would be the dream. So when you think of healthcare data, you might think of interoperability and the different standards that are related to being able to transfer information between different systems. But there's also the differences between structured and unstructured data. So you might have unstructured data in the form of clinicians' notes and dictation notes, which might exist in audio format. And this can be difficult because it might not have a standardized format. So with the advent of machine learning tools such as natural language processing, we can really see that natural language processing is starting to really be integrated into the healthcare field. And I'll link to a recent article on Google Health announcing Meditech as the first EHR vendor to integrate with Care Studio. Some of the natural language processing involved with this is Google Health's search functionality embedding into Meditech's EHR. So clinicians can find information faster for a more frictionless experience, and intelligent summarization can highlight critical information directly in the Expanse workflow. This is a statement from Google. And so we can start to see that natural language processing really starting to take a hold in the healthcare field. And not just, search functionality, we can think about sentiment analysis, which can categorize healthcare data into positive, negative, or neutral statements if we're thinking about patient satisfaction scores. So instead of just having a numerical scale, ranking their experience from 1 to 5, we can allow patients to detail their experience in a free text field and then categorize this information into positive, negative, or neutral statements. And then this can help hospital staff to directly act on areas of improvement or celebrate areas of success. And so let's talk about the last topic, which is volume. So when it comes to healthcare data, the volume of data that is collected daily by healthcare organizations is rapidly increasing. And this can lead to considerations when it comes to protecting large amounts of sensitive health information. In the past few years, especially during the pandemic, there's been several cyber attacks on hospitals. Recently, there was a large cyber attack on Newfoundland and Labrador health systems in Canada, which resulted in the cancellation of thousands of medical appointments across the province and downtime issues where some hospitals had to revert back to entering data into paper charts. Access to data in hospitals and healthcare organizations can be highly valued because hospitals don't just carry health data, they can also house financial and geographical data on patients. And so there's this discussion about moving to the cloud or having solely an on-prem solution or having a hybrid solution. When it comes to cloud storage, this consists of renting storage from external vendors, from companies such as Amazon and Microsoft. And one of the benefits of moving your data to the cloud might be the ability to have backups of your data, rather than just sole reliance on an on-premise solution, where if there's a cyber attack that affects the main servers, this might result in clinicians having to enter in data manually into paper charts for a long period of time, leading to potential increased data entry errors and missed records. But of course, when we talk about outsourcing your data, you can't miss the conversation of potential privacy and security issues that might come along with this. So it's important to ensure that when moving large volumes of healthcare data, to be aware of the retention and disposal policies of these external vendors. But one of the benefits of moving your data to the cloud is the ability to integrate your data with analytical tools such as Power BI or Tableau. And these data visualization tools are great to be able to visualize large quantities of data and transform raw data into actionable information. So these are just some data challenges that health informatics professionals might be aware of when it comes to dealing with the veracity, variety, and volume of ever-changing and growing healthcare data. So of course, I'd love to hear from you. What are some of the data challenges that you have run into when it comes to analyzing and processing healthcare data? You can drop me a line at healthanalyticinsights@gmail.com. And I hope you have a wonderful day. Thank you for listening to the Health Analytic Insights podcast. I'd love to hear from you about topics I should cover in future episodes. Please consider subscribing and leaving a review. Have a wonderful day.